My name is Ann Maguire, and I'm an internal medicine physician. I've been practicing at Froedtert in the Medical College of Wisconsin Health Network since 2003. I attended the University of Pennsylvania School of Medicine in Philadelphia, and then following that, stayed in Philadelphia for my residency at the Hospital of the University of Pennsylvania. That's where I met my husband, and then we moved to Baltimore. And during the time I was in Baltimore, I completed a fellowship in general internal medicine and got a master's in public health at Johns Hopkins, and then eventually made my way to Wisconsin. So I'm an internal medicine physician, so the patients that I take care of are adults. That means 18 and over. My practice over the last 10 to 20 years has really evolved from a general primary care practice into a little bit more of a specialty practice. I have a focused interest in taking care of patients who are either actively being treated for cancer or who may be cancer survivors. In the spring of 2022, I completed a 6-month training course at the City of Hope Cancer Center in San Diego, and this has created an opportunity for me to pivot my practice further into specializing in caring for patients who have hereditary cancer syndromes. So having completed that certification in September of 2022, we started a new hereditary cancer program here in Milwaukee at the main campus hospital. My philosophy has probably evolved maybe just as I've gotten older. And I think what I've tried to do is to really just ask the patients what is the most important thing to them. And since I do tend to have a practice that is a sicker group of patients, and I have a lot of people who've been through some pretty awful experiences, they've been treated for cancer, they are being treated for cancer, you know, many times what their priorities are might not be what my priority is. And so I think that the most important thing I've learned over the years is to make sure that whatever it is we're doing during the visit, that at least we address the main concern that the patient had when they came to the appointment. The Hereditary Cancer Management Clinic is different from a primary care practice. We're located in the cancer center. I practice collaboratively with a nurse practitioner and also a certified genetic counselor. Patients that are referred to our clinic are either those who have become aware that they have a family history of a mutation that increases their risk of cancer. Many of our patients are actually cancer survivors who, during the course of their treatment, it was identified that they have an inherited mutation. And then there is a third group of patients that just have a very suspicious family history, are worried that they might have a hereditary cancer syndrome, who are seeking our assistance with making a diagnosis. And when they come to our clinic, our focus is really on getting a very, very detailed family history. Once we've identified that they do have a mutation, we are able to employ all of the current state-of-the-art screening strategies, and more there are becoming therapies that can be available, not for all cancers, but certainly for some of our breast cancer patients who are at risk for breast cancer, there may be some therapies. We also have collaborations with our surgical team so that, especially for women who may have a hereditary cancer syndrome that increases their risk of breast or ovarian cancer, we're able to connect them to the appropriate breast or GYN surgeons. And we also have a very robust program for pancreatic cancer risk patients. So by coming to this clinic, it's sort of like a wraparound, one-stop shopping. They can get all of their screening updated, and then they can be referred to a specialist that's appropriate based on their hereditary syndrome.